We're joined by attorney Susan Ethridge. Good to see you.
Thank you. Good to be here.
And we're talking about how things worked out in Tallahassee. What is legal, what's not legal with medical marijuana. So why don't we walk through a little bit here, at least a couple of those. First of all, there was a 90-day waiting period. What happened with that?
That has been taken out of the new legislation. So there is no longer a 90-day waiting period. So you can go to the physician. The physician will have to review your medical records, and they will examine you. And if they determine that you qualify for medical marijuana or low THC cannabis, then they can recommend it for you.
And no more 90 days waiting.
No more 90 days. Which
makes sense. It's medicine. Who wants to wait 90
Correct.
days for their own medicine? How can I consume it? I know there's vaping and different things.
Yes.
What's legal?
Well, what's prohibited is smoking the flower. So a lot of people think of marijuana as smoking, through a pipe or with a rolling paper. So that is prohibited. But there are many different ways that you can use cannabis now. You can vape it, which is done with an oil generally. You can use creams, capsules, tinctures. So there's really a wide variety, and all the dispensaries have their own products. So the patients will go to the dispensary and they'll be able to view the products and using their doctor's recommendation, determine the product that's right for them.
When I get my prescription, I know there's how many different periods? 3, 70-day. How does that work?
Yes, you get a doctor who's qualified can recommend up to 3 70-day supplies.
Before I have to go back and see the doctor.
Yes, but when the dispensary when you're purchasing from the dispensary, you'll get a 70-day supply if your doctor has recommended that. And then again, you could, if the doctor recommends it, renew for 2 more 70-day supplies.
Technically here, we're not really giving legal advice. We want to remind people about that.
You can't, legal advice, we have to know your particular circumstances. So this is general information and shouldn't be taken as legal advice.
Which kind of branches off to my next question. Employment, some employers are going to say yes to this, some are going to say no. So again, it comes down to the individual, doesn't it?
Yes, so you as a patient, it would be the responsible thing to check with your employer and to find out what the rules are with your employer, because different employers, and you may work as an independent contractor too, so whoever you work for, they may have different policies.
And what about the snowbirds? They come here at least once a year. What about temporary residents? And did they work it in there for them as well?
They did. So they changed things. So seasonal residents, that's what they're called. They have to show certain documentation, but seasonal residents can now have access to cannabis in our state.
Good. We have a lot of elderly and senior citizens that come down on a semi-regular basis.
Yes.
And if they're maybe even using medical cannabis in another state, it's good to know they can come here and use it as well.
Yes.
Well, keep the fight. This is what's so wonderful about what you're doing and what the people at Tetra Health Centers are doing is we're doing it professionally, we're doing it legally, and it's going to change a lot of people's lives for the better. It's been so great talking to you.
Thank you. I appreciate it, and I don't want to look at it as a fight. I really look at it as bringing us all together to a more positive place.
Thanks again.
Thank you.